Dr. Bradshaw.
Hi, hi.
Nice to meet you, Mrs. Smith. Taking my hands. Hi.
Hi.
All right, so as you can see, I'm here with my team,
Uh-huh.
and I'm gonna let you know what we've come up with for your daughter so far, okay? So your daughter is a 2-year-old female who is here for respiratory distress and has had a fever for a couple days. So your daughter, Julia, is a 2-year-old female. You reported a 7-day history of a cough and a fever that's been present for the last 3 days. The cough was initially dry, and the patient had a runny nose. The cough was intermittent and seemed to be worse at night. There's at least one incidence of vomiting that came after a particularly heavy coughing fit. About 3 days ago, you reported that the cough became wet and productive with green sputum, and that 3 days ago the fever popped up, and the max temperature you recorded through the ear was 103. You noted that Tylenol relieves the fever, but only temporarily, that it consistently comes back when the Tylenol wears off. You've also noted that the patient has been more tired than normal, taking additional naps. She's continued to eat and has been drinking, but that you reported 5 wet diapers yesterday, as well as 1 loose greenish stool, which is abnormal for your daughter. For sick contacts, apparently her 4-year-old brother was recently sick with a cold and congestion, but his illness resolved after a few days. No recent travel, but that your daughter has been to the zoo recently, within the last week with her grandparents. Her past medical history was positive only for GERD as an infant, which resolved within the first 12 months, and she's had a prior hospitalization at 7 months for wheezing, which required an albuterol neb overnight. No surgical history. For meds, you are on albuterol at home, but she is not. No known drug allergies. She's up to date on her immunizations, except for the ones for 18 months. For the family history, there's extensive asthma. The mother, you, the sister, and her brother all have asthma. And she lives at home with you, dad, sister, and brother in a detached townhouse. And in the house, you also have a cat and a dog, and an occasional issue with mice, as well as wall-to-wall carpeting. Okay? And we'll talk about why that's important. On her review of systems, she's been increasingly fussy. She's also sleeping more, as we talked about. There's congestion and a little bit of respiratory distress, wheezing with productive wet cough, but no diarrhea other than the one incident noted, and no vomiting other than the one time mentioned that was secondary to the coughing. No rashes were noted. On physical exam, she had a temperature today of 101.3, and her respiration was 40, which is high. The rest was normal. The rest of her physical exam, the pertinents were that she had a bilateral clear nasal discharge. She also had inspiratory crackles on the left side of the lower part of her lung, and occasional wheezes when she took a breath in throughout both sides of her lungs. For her labs, they were generally normal. Her glucose was a tiny bit high. So all of this leads us to what we think is going on with her. You have a 2-year-old female with a recent onset of a productive cough, low-grade fever, and tachypnea, which we think is likely a bronchiolitis secondary to respiratory syncytial virus. It's something very common in kids. We say this because of the tachypnea, the low-grade fevers, and the productive cough. Alternatively, she could have croup, which is also caused by the same virus, the RSV virus, or influenza. It generally has a more severe presentation, though. It does have the low-grade fever, the clear rhinorrhea, and the tachypnea, but it usually has a barking cough, stridor at rest, and retractions, which means visible difficulty breathing, which we don't see in your daughter. So for the list of problems, the things we want to address, her respiratory distress. For one thing, we want to start her on pulse ox monitoring And based on the reading we get, we could consider starting her on oxygen therapy. We could consider a round of IV rehydration. We could also consider putting her on a bronchodilator, kind of like the inhaler she had at 7 months, just depending on the reading we get. We also want to address her fever, which we will do with Tylenol. And another thing we can consider is a lot of people in your house have asthma, and you have things in the house that are related to that, like the pets and the carpeting. And so we might want to consider having you talk to someone about like allergy issues. Okay, do you have any questions?
Do I have to get rid of my dogs?
I'm not saying that you do, but we should talk about it.
All right.